In order to really know what abnormal breathing is, we should know what normal breathing is. So normal rate and depth, so a normal tidal volume, not using any muscles outside of the normal or ordinary to breathe, a regular rhythm or pattern, good clear breath sounds on both sides of the chest when listened to with a stethoscope, rise and fall on both sides of the chest that's symmetrical, and then movement of the abdomen, but very quiet movement of the abdomen. There shouldn't be a lot going on there. So inadequate breathing in adults. Labored breathing. It looks like the patient is just struggling to breathe. You can see the effort it takes just by looking at them. Typically, they're going to be using some accessory muscles, so muscles other than the intercostals and a little bit of abdominal. You might see retractions above the clavicles or between the ribs, below the rib cage, especially in kids, below the rib cage. Breath sounds may be diminished or absent when you listen with a stethoscope. Your patient is going to have pale, maybe cyanotic. Cyanotic, remember, is that bluish coloring. Might have cool, damp skin, which we call clammy. They may be seated in the tripod position, which is your patient leaning forward, kind of hinged at the hip, and then their arms stretched forward on whatever they're seated on to kind of keep them in that position. Agonal gasps, also called gasping breaths. And you can have some of those gasping breaths after the heart has stopped. It kind of looks like a fish out of water trying to breathe, or just any sort of abnormal breathing. You can have that even after the heart stops. Circulatory system. So this is our cardiovascular system. It's very complex. There's a lot of different tubes that move blood throughout our body in order to take oxygen to the tissues and then to remove carbon dioxide so that it can ultimately be removed from the body. You start on the side that has the oxygen in this slide. So you have your arteries, which are big. Arterioles are a little bit smaller, but still carrying that oxygenated blood. Capillary beds are where the arterial and venous meet up. They're very thin. They allow for the fusion of those gases. Venules are small veins, so after we have dropped off the oxygen and we're moving carbon dioxide up, venules are going to be the first level that you are in, and then veins are the biggest for the non-oxygenated side. There are two circuits that blood is going to go through. So you're going to have systemic circulation. So this is everywhere in your body that you're going to exchange blood or move blood so you can exchange oxygen and carbon dioxide, And then you have pulmonary circulation. This is how you're actually going to get the oxygen into your blood and get the carbon dioxide out of your blood. So pulmonary circulation is very short. You're going to the heart, from the heart to the lungs and then back to the heart. Systemic is everything else. So here's kind of looking at those two circuits. You can see that there's capillary beds, which are the purplish because it's a mix of the venous and the arterial blood there. You have one in the upper body, you have one in the lower body. On this representation, realize that there are several capillary bodies throughout the body, but just kind of trying to show you. And then one in each lung as well. So this is going to track your general blood flow. You've got blood coming from the upper body and lower body through the vena cava. It's going to go into the right atrium of the heart, down to the left atrium of the heart, which is then going to pump blood to both of your lungs to become oxygenated. That oxygenated blood is going to come back into the left atria, down to the left ventricle, and then out to the body. The atria are the two chambers on the top part of the heart, ventricles are on the bottom, and we'll go into that a little bit more. The heart is a hollow, very muscular organ. It's about the size of an adult's clenched fist, give or take. It has that cardiac muscle that we talked about earlier, and it's actually called myocardium. So myo being muscle, cardium referring to the heart. The heart works as two paired pumps. You've got the upper portions of the heart, which are the atria, and then you've got the lower portions of the heart, which are called the ventricle, and the two pumps work to squeeze top, then bottom, top, then bottom. In between the two, there's a septum that isolate the right from the left. So circulation. The right side receives blood from the veins. The left side receives blood from the lungs. And this says heart, but it's actually body. The body receives its blood from the aorta. That's the large vessel that carries oxygenated blood from the heart out to the rest of the body. So a little misprint there. So here's how we've been looking at this. Superior vena cava is going to drain the head and upper body. Inferior is going to do the entirety of the lower body, up into the right atria, down into the right ventricle, and then out through the pulmonary artery. That's going to take it to the lungs. Your pulmonary artery is the only artery that carries deoxygenated blood. Deoxygenating mean without oxygen. And then you've got the left side. It's going to come back through the pulmonary vein. These are the only two veins, or two sets of veins, that carry oxygenated blood. So it'll come through there into the left atria, down to the left ventricle, and then up into the aorta and out to the rest of the body. There's a video representation here that you can pull up and watch how it goes through. Also, check out YouTube or Pinterest. There's a lot of good representations. Normal resting heart rate is anywhere between 60 and 100 for the average person. People that tend to be in really good shape, so athletes, tend to have a resting heart rate just below 60. And that's not uncommon. But most people sit somewhere between that 60 to 100 range. Children, their normal is 70 to 140. Toddlers tend to be 90 to 150, and then infants 100 to 160. So it kind of goes up the younger that you are. Stroke volume is the amount of blood moved by one heartbeat. Cardiac output is the amount of blood moved in 1 minute. So cardiac output is the measure of your heart rate times your stroke volume. And that's for a minute. So your heart rate in 1 minute times your stroke volume equals your cardiac output. In a minute, your entire blood volume, which is about 5 to 6 liters, is circulated through your vessels. The electrical conduction of the heart. So your heart is quite interesting. The cells can contract, they can generate electricity, and they can conduct electricity, which is pretty cool. And it conducts it so fast that the entire top of the heart contracts at one time, and the entire bottom of the heart contracts at one time. Now, if you're feeling your pulse, like in your wrist, in your neck, that you're only feeling the left ventricle pumping blood to the body. So that's the pumping of blood just out of that left ventricle. But if you take a stethoscope and listen to the heart, you actually have two sounds. It's called the lub-dub. And in order to make everything work fluidly, your heart has to take an electrical impulse from the top of the right atria and spread it all the way across the whole top of the heart very, very, very quickly. That allows for very smooth, coordinated contractions so that your heart is beating in rhythm together. And that beating is what pushes that blood forward. There are two electrical processes that cause the conduction and the actual squeezing of your heart. You've got depolarization, in which the electrical charge on the surface of those cells goes from positive to negative, and then the heart will return to its resting state, and you'll have that positive charge restored. In order for it to change, it has to have something that gets it started. So just like a fire needs a spark, or the engine, you need to turn your key on, you have to have something that starts that out. So you have one area in your heart called the SA node, so sinoatrial node, that sets the rhythm and the pace. It's called your pacemaker. And then everything follows after that. It goes from that SA node in the top right of the right atria to the AV node in the left bottom of that right atria. Then it travels down through into the bundle branches, which are in the septum in between the two ventricles. And then it comes around to what are called the Purkinje fibers, which kind of stretch around the bottom of the heart. If this is interrupted, it can cause some severe problems within the heart. All right, arteries. Arteries carry blood from the heart to body tissues. They branch into arterioles. Arterioles branch into capillaries, which we've definitely talked about. The only one to carry deoxygenated blood, remember, is that pulmonary artery. And then we've already talked about creation of the pulse. Major arteries. So the aorta comes from the left side of the heart and carries freshly oxygenated blood to the rest of the body. Your pulmonary vein. So this carries deoxygenated or oxygen-poor blood from the right ventricle out to the lungs. Your carotid artery is the major one in your neck that you can feel. Pulses out, there's one on each side. This supplies your head and brain with blood. Your femoral pulse, which is, or your femoral artery, excuse me, you can feel the pulse kind of in the crease of your groin, and that supplies the lower extremities with blood. You have the posterior tibial, so you can actually feel the posterior surface of the medial malleolus, so that bump that's on your ankle, you've got two of them. So the one that's toward the midline, so on the inside of the leg, if you reach your fingers just behind that and don't press too hard, you should be able to feel a pulse there. And then your dorsalis pedis is on the anterior superior aspect of your foot. You also have your brachial artery, which is, you can feel it on the inside of your upper arm, about the midway point on your bicep, and then it's basically dead center. This is going to supply your arm with blood. This is what we're going to occlude or close off when we take a blood pressure. And then your radial pulse is there in your wrist. It's the major artery of your lower arm. You can feel it on the thumb side, because remember the radius is that thumb side. In the very center of your wrist, you can feel kind of some hard strings. Those are tendons. So if you go halfway between the tendon and the outside of your arm on the thumb side, and you press relatively lightly, you should be able to feel a pulse. Here is a representation of all your major arteries and veins. And we'll continue on in the next video.